I'm Chadi Diab, one of the vascular interventional radiologists at the University of Kentucky. We'll be recording a set of videos showing the different TIPS kits and how to obtain portal vein access under fluoroscopic guidance. Okay, we're going to present different TIPS kits. They have similarities. Some of them comes with sheath within the package, some not. The package, like if they have a sheath, most of the time it's a 10 French sheath. The other similarities, most of like the needles or the kits, they're gonna have a curvature to point from the hepatic vein to the portal vein, and they're gonna have some way of pointing or telling you where is the angle where you're pointing at. That's kind of the pointer. Similar, for example, this is the ring needle. Okay, this is a 10 French flexo sheath that comes with the ring and the Röshe Uchida kits. These kits are from Cook. We're going to start with talking about the ring kit first. It comes with a hollow needle that's curved, that's sharp, with a protective catheter. So you load it like that after you flush them. And as you can tell, you don't advance it all the way because this is a sharp needle. So you leave it like that, and then after you have the sheath of the hepatic vein, you insert this cannula over the wire, this catheter, and then you're gonna point it a little bit out, and then you're gonna be doing your puncture through this sharp angled hollow needle, and then after that you aspirate blood, confirm with contrast, and pass a wire through this hollow needle. So this is the ring, also known as cola pinto. Gore has a very similar system, hollow needle within a catheter, very similar, and they have their own sheath as well that comes within the packet. Okay, demonstrating again, you insert the catheter through the sheath from the hepatic vein, and then again you have the arrow there. Pretty much you poke it, aspirate blood, confirm with contrast, and then pass your wire. The Röshe Uchida kit is different. It comes with a solid stylet, non-hollow, that you're gonna preload within this 5 French catheter. Okay, and then when you install, like when you have opened the kit, you're gonna have this angled cannula that's not very sharp, and then when you insert it through its dedicated catheter, it does not go beyond the edge. So when you push it all the way, it does not go beyond the edge. So this is going to be an angled stiff cannula. So you're going to insert this over the wire, you're going to point it where you want to target the portal vein, and then you're going to insert this trocar catheter / stylet, and then you'll poke the portal vein, and then at this point you switch your hands to hold the cannula and the catheter, and then you remove the inner solid stylet. So now we have a cath inside the portal vein, you aspirate the blood, confirm with contrast, and you insert the wire. This is the 5 French catheter. Okay, so this is the Röshe Uchida. The benefit of the Röshe Uchida, you can use it to angulate with a stiff cannula without having a needle protruding out. So you're having like a angulation without having sharp needle pointing in the parenchyma. The Bard and the Scorpion, they do have a little bit additional features. Again, everything is operator dependent in that. The Bard it's called Bard Liberty, is a new system. It comes within this stiff cannula, but that you can control the curvature. You still have to go through the sheath, okay? And their kit comes with their own sheath too. So you go where you want, and then it comes with this where you can rotate. So the more you go towards the plus, the more it curves, okay? And you can curve it all the way, it will give you an angle of 75 degrees. Okay, if you can see, that's how much it curves. And another thing I would say, if you haven't used it before, it comes with a specific area here, like where it tells you like how much curvature you already created, because remember, inside the body you won't be able to see how much it's curving because it's inside the hepatic vein and it could be in plane, so you may not see the curve. So this is kind of, I would say, if you haven't used it before, get familiar with where the marker is, it correlates with what type of curvature. And if you just have it just like at the top like that, it will give you this typical classic tip skit angle. For example, if you want to compare it to the ring, which most people like can be familiar because it's one of the old kits. So this is like the curvature, okay? After you created that angle that you want, you have your position. They also have a system, coaxial system. It's a hollow needle. Their needle, they say, is also kind of a little bit special because it has something, this technology called flex cuts. There are like cuts on the edge of it, so it allows it to create curvatures, like big curvature without bending. This 18 gauge needle is preloaded with this 5 French catheter. So this coaxial system, you're gonna go in pretty much like the other, okay, poke the portal vein, and then you get the option to aspirate the blood through the needle, confirm with contrast, and then you can insert the wire through the needle, or you can remove the inner needle component and insert the wire through the outer catheter. Okay, so this is the bar. Scorpion from Argon, they have 2 kits. Pretty much both of them have similarities in, they have a cannula that has similar curvature, and then they have either a hollow needle within a catheter or a solid needle within a catheter. The hollow needle, it's the Argon X, and it comes preloaded within a 6 French catheter. Okay, pretty much you have the cannula again through the sheath, and you're about to access the portal vein. So the main feature of the Scorpion is you can create 2 curvatures. So the cannula itself has a fixed curvature, but then the needle itself has its own curvature. So let's say you poke the portal vein, or you advance the needle, but you didn't access the portal vein. But you find out, like based, let's say I was using ICE ultrasound, intravascular ultrasound, or based on obliquities, that you need to angulate a little bit more posterior. So you don't have to pull back the cannula all the way out. You can just pull back the needle that you advanced, and then you can rotate kind of posterior opposite to your anterior guiding cannula, and that will allow you, for example, to go, like if you rotate it like that, now you're advancing a little bit less anterior. You point it posterior, but in the end you end up having less anterior puncture, and allows you to target that portal vein that you felt it is a little bit kind of behind your needle that was anterior to it. So that feature of secondary angle or 2 curves is the main feature of the Scorpion. Besides, like, hey, less anterior, less posterior, you can even go more medial or more lateral based on what you need using the secondary curvature of the needle. It can be helpful, especially with intravascular ultrasound, or if you have biplane. The other system of the Scorpion, pretty much very similar regarding the curvature, except that this one has a solid stylet within the catheter, very similar to the Röshe Uchida, just like the system.